First art therapy protocol that we worked on is based on Scribble drawings, and it's actually something that we use to cross into relaxed client and to somehow not start with something serious, to either think about easy way to begin the session, work with subconscious, and just to use non-verbal means. So we start with basic scribbling, usually using non-dominant hand, and we kind of play with it with whatever media is selected. And the first portion of it that you ask the client to just do something random. Occasionally we can start with just making some kind of movements through the air. So in that way you ask them to bring their emotions in the movement. So sometimes people are very relaxed, sometimes they're really busy or anxious. So they do it through the air, and then they put their hand on the paper, and then they do the scribble. And you let them scribble for a little bit, and then you stop them at some point before it becomes too busy. And then you ask them to look at the drawing and then kind of turn it all different directions. Or maybe you can put it on the floor and walk around it and try to find the best view of that particular drawing, and then project into it. And basically it's kind of the projection where you try to find the meaning for that drawing, and then you can use both hands, you can use your dominant hand, you can use any media you want, and you give them a little bit more time to actually spend doing it. And usually what it comes to is somehow it's way that people try to tell you something about themselves, and it's usually something that is just kind of the first view of themselves, and it can be very on the surface, kind of just that particular emotion from that moment. It can be something that's brought to you from being a very heavy burden, but it's kind of opening of the conversation. So it's one way of using that single scribble drawing. A different way is to use scribble drawings in pairs when you want to do some kind of relational attunement or creating the relationship between two people. So you can be using between a therapist or a group leader and the client, or it can be between two clients. And you try to do it with a large piece of paper, and you do some kind of mirroring, and it can be with one hand or with two hands, dominant or non-dominant. And you can do it with assigning who is the leader and who follows, or you can just let the two of them decide what's the best way. But the important is to watch each other's eyes and to maintain that contact. And it's really about creating the relationship between the two people, and it doesn't really matter what ends up being on the paper. It's really about trying to get the dynamics of two people and how that, what happens. And anything can really happen. It can be really that each person stays in their own space. It can be that people try to cross in each other's space, that becomes too aggressive, becomes really shy, that one person becomes aggressive, one becomes really shy. It can become funny, it can be silly, that people, just start laughing about it. It can become really intimidating for somebody who's kind of afraid of, having an eye contact, but it kind of gives you a lot of feedback about what that relationship is all about.